Welcome, everyone. This is a presentation on the art of parenting while sick, on being a parent with a chronic condition, and everything that that entails is obviously a much bigger topic that we could spend hours on. Today, we'll just be talking about how to talk to your child about a condition, whether it's a new condition, a recurring condition, maybe it was in remission and it's come back, a condition that's worsening, maybe you've developed an additional condition because of your primary condition, a comorbidity that's very common. And then how to respond if your child witnesses you having a medical emergency and how to set household guidelines. So those are the big topics that we'll be talking about today. That's the agenda. I'm going to skip the ground rules because we're going to just jump right into the content. But a little quick introduction for me as to why I'm passionate about this topic. I am a mom. I have two chronic health conditions, severe asthma and Addison's disease. Both of these landed me in the hospital several times before my son even turned 3. And I really wanted to find a book about how to talk to him about it. I figured that when I went onto Amazon, I would find, 12 to choose from, and there were none. And that is just bizarre in a world in which more than a billion people have chronic conditions and hundreds of millions have conditions that are pretty debilitating and unpredictable, like lupus, rheumatoid arthritis, ALS, cystic fibrosis, um, endometriosis. I can keep going on and on, but autoimmune, genetic, there are many, many, many parents who are absolutely incredible and wonderful parents, but who feel pretty stressed by trying to take care of both themselves and their kids when they're juggling um, not feeling well, having difficulties getting in to see specialists, having difficulties with diagnosis, reactions to medication, unexpected surgeries and hospitalizations. So to write the book, I spent more than 100 hours interviewing parents with a broad range of conditions, many of which I mentioned and many more. Tons of doctors, researchers, child and family psychologists, geneticists, and so that's how I developed all of the materials. And honestly, I would say that the best information, the best tips I got were from parents who have figured it out as they've gone, and in particular, parents with adult children who had decades of experience learning how to manage parenting from the couch on hard days and all kinds of things. So I'm going to jump in to why and how to talk to your child about your condition. First and foremost, you might be wondering, why do we need specific questions? And I mean, why do we need specific resources rather? There are several reasons. Our condition impacts our whole family, not just ourselves. They need to know and understand the basics of our condition to be able to support us. And sometimes we can be hesitant to talk to our kids about our condition because we might worry about freaking them out or scaring them and try to hide it. But kids can always tell what's going on, as we'll get into in a minute. So that's why we need scripts and age-appropriate strategies for how to communicate effectively with our kids. Um, so why do you need to talk to your child about what's going on? Well, first of all, they'll be able to tell if something is going on. Kids are very perceptive. If you're not feeling well, if you're taking new medication, if you're sleeping more, if you're whispering on the phone with your sister, they notice all of that. If you don't tell them what's going on, they might fill in the blanks with something that's much worse. Or they might hear about it from a family member, a friend's parent. I've heard that happening actually a surprising number of times. Even you on the phone when you don't think that they can hear you at night or in another room. So when your child hears about it that way, it makes them feel like maybe it's too scary for you to tell them about and makes it seem even more grave, or maybe like you don't trust them to have that information. So these are all the reasons why it's important to just be very straightforward and to overcome that feeling that you might have of um, being worried that you're going to freak them out. Because if you do it the right way, you won't. So when you're upfront and honest with your child, you show them, one, that they're an important and respected part of the family, just like everybody else. Two, that you take their feelings and opinions seriously. And three, that you have faith that they can handle this difficult situation. You also establish yourself as their conduit of information, which is important. That just lowers the likelihood that they're going to get online and Google your condition and freak themselves out by finding misinformation. So you make yourself really, truly the source. One of the best books that I did find on this, now again, it's for more serious illnesses. I'm working with long-term illnesses where people might have average lifespans. So this book is not quite right for that. This is more about preparing for really difficult things. But the author, Kathleen McHugh, was a fantastic child life specialist who ran a program at Cleveland Clinic for many, many years, helping families. And over working with hundreds of families, she found that the parents that were the most transparent and straightforward and communicated had children with the fewest behavioral issues that came out of this family difficulty. So she just has great data and evidence on the importance of just being really straightforward and honest. So I just want to establish that as a basis that there is some data behind this. There are I'm going to go over 5 steps for talking to your child about, and I'm going to reiterate what I said before, a new condition, a flare up of an existing one, a condition that might have come back from remission, a worsening condition, or a new comorbidity. Those are all common reasons that parents are going to have to check in with their kids about what's going on. So we'll go through each of these steps. In each step, as you'll see, effective communication combines honest and clear information with reassurance. And the reassurance is really important. So you're going to see that through each part of the script. And you'll see how if you just give them information, that might frighten them a little bit. If you only give them reassurance, that doesn't give them enough information to process it. So it's really a matter of constantly blending the two. Before you talk to your kid, these are just some quick tips. And I often use the word child in the singular. Even if you have multiple children, you're going to talk to them each differently depending on their age and maturity. And so I'm just using the singular for that reason. Be sure you're ready. If you do have a new condition that you're pretty upset about, and you find that you're having a hard time talking about it without getting teary or getting worked up, you're probably not ready to talk to your child about it. So that is important to practice that's why it's important to practice what you're going to say a few times with a friend or a family member, a therapist, even by yourself, until you feel like you're really ready to be calm for your child. 2, take notes on all the steps we're going to go over so that you can make sure you remember everything you want to say in the moment and that you make sure you write down those bullet points of reassurance. 3, think about logistics. So where is the conversation going to take place? In the kitchen, the living room, good neutral spots. Doing it on the weekend is ideal. That gives your child time to process. Doing it before school, when you're in a big rush, obviously is not great. And on a weeknight when everyone's exhausted or hungry, not great either. So weekend's a good time to have these kind of conversations. So first, say what's going on. Keep your language simple, clear, and straightforward. You can talk about the body parts where your condition's manifesting. If you have a young child, you might use a doll or a pamphlet. Talk about your symptoms in brief and how your doctor diagnosed the condition. For my sample scripts, I'm using diabetes, since type 1 diabetes is one of the most common conditions in the world. It's an easy one to draw from because a lot of people are familiar with it. I'm not going to read all the scripts. I'll leave them on the screen for a minute and you can read it, but this is a good example of what happened, what the doctor said, how they diagnosed it, and so on. So I'll leave it up there for a minute. Okay. So you'll see here, almost 600 million people around the world have it. That's 1 in 9 people. That is an example of what I mean by reassurance. It's making your child comfortable and understand that, oh, okay, what's happening to my parent isn't that crazy. There are many, many, many other people that have the same thing, that live long, full lives, and that are well taken care of, and that makes it less frightening. Next step is to talk about your treatment plan. Any new medication or new apparatus that you might have, pumps, an oxygen machine, a cane, a wig if you're going through chemotherapy and losing hair. So describing any kind of new medication or support that you're going to have. For medication, when and how often you'll take it. Is it a pill? Is it a pump? Is it a shot? And just really simple terms how it works. So for insulin, for this example of diabetes, you can show your child a pump. You could show them the cool little app that you use to track your glucose and just explain that insulin helps your body keep your blood sugar regulated. I'll leave again this script up for a minute for you to read. And again, you see the reassurance at the end. Almost 150 million people around the world are taking insulin. So you're helping your child again know that what you're taking, what you're doing is very well established. Lots of other people are doing it, even if you can't see visibly that they have a pump or are taking insulin. Reassure them that you're in good hands. This is when you can talk about your doctor, your nurse, any healthcare professionals, just so that they can picture and visualize who's taking care of you. Can give them any kind of details you want. My doctor's office is yellow. It doesn't matter. It's just giving them something that they can picture because they're not there with you, and reassuring your child that your doctor deals with this condition all the time. Maybe it's their specialty and entirely what they do. And that again helps your child say, oh, okay, this is something that is so common that someone does this for a living. So I think for this script is the example I have a doctor that has a fish tank because I had a doctor that had a fish tank and I think my son would love that. So that's step three. Step four, talk about how your condition will affect you and them. So anything that you will be doing differently, you might be staying at home more, you might be sleeping more, you might be having to go to the doctor more. And any changes to the family routine, maybe your partner will be cooking dinner more. Maybe you'll be eating more frozen food for a little while because that's easier. Maybe you need your child's help walking the dog, but anything that's going to change and just being specific and making sure that they know so that because kids really need a lot of sense of structure and order and routine. So if they're gonna be going to basketball practice with a friend's parent for a couple weeks because you need to do XYZ, it's helpful to just tell them so they know that that's coming rather than tell them right beforehand. So here's another sample script. I'll leave it up for a minute. So in this example, I have, like their aunt might be taking them to soccer, and you're going to keep them posted in terms of the reassurance. The final step is to say what you need from them, which is what we basically just talked about. If things are going to change, how can they help you with that? So in particular, let's say that you have a new diagnosis of lupus or rheumatoid arthritis, something that's really causing debilitating joint pain, and it's hard for you to use your hands and fingers, and maybe you're in a particularly bad flare-up right now. Maybe you need their help loading the dishwasher or weeding or, cooking, whatever the thing might be, but just making it very clear that they can help you out. Kids love to help. So just being very specific about what you need and why. And ending the conversation, this is critically important by saying, establishing again that you are in control, you are managing your health, and they don't need to worry about you. You've got a doctor helping you, you're on top of things. The best thing that they can do is enjoy their life. Sometimes kids feel guilty if their parents are going through a difficult time and they're still having fun and seeing their friends, then they feel guilty. So if you can nip that in the bud, that's one of the healthiest things you can do to help your child adapt to any changes around your health. So I'll leave this script up and I'm going to read the last paragraph because again, I really want to reiterate how important that is. So like I said, ending on that note of even if I'm not feeling well, you never need to feel guilty for focusing on school or having fun, enjoying soccer. The best thing that you can do for me is to enjoy those things. Giving your child permission to be a child is critically important. So this script works very well. You can adapt it however you want, use it constantly. Really, if you take anything away, it's just to constantly blend information with reassurance, always remembering to pair those two things. And to use it to update your kids, to use it to tell them about any changes in your condition. and it's appropriate for ages about 5 to 13 or 14. So now we're going to look at scripts that are more appropriate for very young children, and then some things that you can do with teenagers. So for very um, young children tend to be a bit more egocentric, so they have a hard time understanding cause and causation and sometimes think that it has to do with them because they are just so much the center of their own worlds. So that's why it's especially important to tell kids you didn't cause this because they might be thinking, oh, I didn't clean up my toys yesterday and mama was really mad and now she's coming in and says it's because I didn't clean up my toys. And we would never make that sort of leap of logic, but little kids that don't really understand correlation and cause worry that they did something bad. So in this case, you can just say something as simple as, I'm having a health problem. It's called diabetes. A lot of other people have it. You didn't catch it. Again, kids might be used to colds or stomach flus that you can catch. So reiterating, this is not something you can catch. You didn't cause it. No one caused it. It's something that just happened. You can give me lots of cuddles or hugs and kisses to help me feel better. Very clear, straightforward, and you can go do something fun afterwards. For teenagers, and this really just depends on your particular teenager and their personality. Um, you can involve them a bit more heavily. For example, they can come to a doctor's appointment with you if they're comfortable doing that and they want to. You can watch a video together. Maybe you need an emergency injection. There are many conditions that require that. Maybe you can watch it with them so that they can start to learn how to do that if they need to. Again, if they're comfortable, it's up to them, up to you. You could plan or attend a fundraiser for your condition together. You could do an online one. You could attend a 5K. Um, there's lots of other examples, but the idea is with teenagers, you want to put the ball a little more in their court and give them a little bit more adult responsibilities without having them take on anything. So before I move to the next section, are there any questions?
No, you're actually hitting on my primary question as I think about my kids. My son is 3, and as I'm imagining how folks with younger kids could do that, I love your note about making sure that they don't know they don't have it, and it's not their fault. I think that's wonderful. And then my kids are preteens, and so well they're 10 and 8, my daughters, and so. Knowing they'll grow up and just you're absolutely right. They have very different personalities, and so I would even maybe tell them separately just to make sure that
Mhm.
they can take it in the right way.
Yeah, and I think there's so many different ways you can do it. You can tell all the kids together, you can talk to them separately. You could tell everybody together and then have separate follow-up conversations in the car where you're really one-on-one with them. If you have an adult child that's out of the house, you might want to tell them before or right after, but really trying to tell everybody at pretty much the same time when possible.
Yeah, yeah, makes sense.
Yeah. Great. That's perfect that you have a 3-year-old because you really are in the thick of it. So you understand how they're thinking on that level of, oh gosh, maybe it's my fault.
Right? They're an excellent point. They are the center of their world, and so anything you tell them will be about them.
Yeah.
Yeah.
Okay, great. Any other questions or comments like that? Okay, I'm gonna go. This next section is pretty specific to maybe a narrower subset, but there are still a slew of conditions that can cause an endless list of medical emergencies. Some of the most common ones are anaphylactic shock, asthma attacks, seizures, um, Addison's, which is the disease I have, can cause adrenal crises. Graves' disease can cause thyroid crises. There's metabolic crises. I mean, it really, the very long list of things that can happen. People with diabetes can have hypo or hypoglycemic shock. So if your child does witness you having a medical emergency, it can be very frightening for them, and it can be frightening for you as well. Fortunately, there is a pretty good framework that you can adopt that will help your child process what happened, integrate it, feel proud about how they handled it, and then make it so that they're much more ready if it ever happens again. You can also prepare them ahead of time for the medical emergency by telling them, following basically the same script as as we just went through, what it is, how it works. It's very common. It happens to lots of people. You might witness it. Here's what you do. If we had all the time in the world, I would go through tons of other resources that I have about how to teach your child how to call 911 and things like that that are also really important. I do have those. I do have the script for how to teach your child to call 911 on my website and Instagram for anybody that is watching this. Those are at the end, so you can find them there if that's helpful to you. But for right now, we're just going to talk specifically about what to do if unexpectedly a medical emergency happens and you need to talk to your child about it. So, you might know this book, The Whole Brain Child. It's a fantastic book, sold a million copies, very beloved, about how your child's brain works. And this topic fits into that because when children undergo a scary experience with no resolution, they can have trauma about it and start showing anxiety, sleep disturbances, have nightmares, or act out in ways that you don't even realize are connected to it. Because they haven't fully processed what happened and they're still feeling freaked out by it. And as you know, as a parent, your child shows fear differently than adults do. So they might show this by acting out a week after something happens. So if you have a sense that your child is feeling upset about what happened, or even if they seem fine and are being blasé, you can still follow this process to help them really work through what happened. So first, encourage your child to tell the story. Storytelling is a huge part of how children make sense of the world and extreme experiences. So, do you remember what happened? Then what happened? How did that make you feel? We can go back to this example of since we were talking about a parent with diabetes, perhaps a parent goes into hypoglycemic shock and the child witnesses it and they get really freaked out. And the parent eats some gummy bears, has some apple juice, takes some insulin when they get home and they're fine. They think everything's fine. The child is still left feeling freaked out by this. So do you remember what happened? Yes, mama was sitting in the grass and drinking apple juice and then what happened? How did that make you feel? I felt, just continuing to push and asking these questions at every step of the story. Then the next point is to say, but think about all the things that you did that were great. You stayed so calm. You sat with mama in the grass. We went home together on our bikes, and then everything turned out okay, and you were safe, and I was too. Repeating that over and over again. And then the last step, then encouraging them to retell that same story, maybe to your partner, maybe to an older sibling, a neighbor, calling their grandparents on the phone, so that they really internalize this story. This scary thing happened, but I helped. I was good. I was calm. Mom was proud of me because I did this and that, and everybody was fine. So that they learn that these kind of things can happen and everybody can be fine at the end of it. So that if it happens again, they feel much more prepared and they've also worked out that anxiety. This was a short section, but important. Are there any questions around this or any comments?
I just have one question. When you started with your, and you may have examples of this later, but the photo of your son, he seemed, pretty young, and so I thought you were going to round out on, and here's a book I eventually found or wrote, like specific for children to read. Just knowing that you said that they process through storytelling. I'm just curious to know if there are any books out there for, younger kids to read or just, kids to read to
It's
understand, how to process things.
it's a fantastic question, and I have on my website a long list of tons of different books
Awesome.
for all kinds of different conditions because that's what's wonderful. Not a lot of books for parents, but
Yeah.
tons of books for kids. So that
Okay.
is
Awesome.
great. There's
Awesome.
books, and what I love, there's so many creative parents out there and creative doctors. A lot of these are written by doctors. On every condition you can imagine. There's
Yeah.
there's
Okay.
ones
That's
just for
wonderful.
lupus, MS, chronic pain. The ones that I have on my website are some of my favorites, and there's one, for example, that is fantastic that's just for, there's two that I think I have up there actually for hospitalizations, because
Yeah.
that's really important. And kids can read that ahead of time to prepare for it. I mean, not ahead of time, but read it kind of
Sure.
anytime so that if it happens unexpectedly, they have that framework. So that's a
Yeah.
really good question. And yes, there are great books for
All right.
kids.
Awesome.
One of my favorites is I don't know if there's any SNL fans, but Vanessa Brer, who's an SNL actress, had leukemia when she was a child and wrote a fantastic book, How to Care for a Very Sick Bear, that's meant for kids to understand diseases, and
Yeah.
it's excellent. So yeah, tons of great books
Okay,
on the
awesome.
website. Final thing that we're going to talk about is how to set household guidelines. Now, this is just pretty basic, but it's helpful again to tell your family they want to help, and it's helpful to tell them very specifically what they can do. We talked already about how they can maybe help out with chores if you're having any kind of physical mobility issues, joint pain, you need to rest more, you're recovering from surgery, but those are kind of more temporary household guidelines, like temporarily helping you with the trash or the um, dishwasher or whatever. Or maybe you want them to take that over full time, but that's not exactly guidelines for the whole household permanently. What I'm talking about are things that are going to help you manage your condition. So, for example, to keep dad safe, let's say dad has an anaphylactic allergy to peanuts. Um, and, you know, or okay, well, for anaphylactic allergy to peanuts, that would just be having a very clear household guideline. Absolutely never any peanuts in the house. Maybe there's a post-it. Maybe that's, to all family members and friends. Um, and then also just kind of cross-contamination guidelines and ensuring everybody understands those. Um, for a parent that might be immunocompromised, I'll talk about that instead. So that's maybe a parent that takes some kind of medication that causes their immune system to be dampened. That might be a little more in line with these examples that I have of every time we get home, we wash our hands for 30 minutes, 30 seconds with soap. We don't bring over friends who are sick or who have been sick. We throw away expired food because a lot of the time, stomach bugs in particular can trigger crises in people that have compromised immune system. Put away food when we're done using it to avoid any kind of unnecessary bacteria on food. So the guidelines are going to be different depending on what condition you have, but they're helpful to, print out, put on the wall, to repeat frequently, and to really praise your child when they do those things. If they're really good about washing their hands every time they come home, pointing it out and thanking them. If they say, "Oh, I wanted to bring home so and so, but she has a cold and I remembered I shouldn't," saying, "That's so sweet, that's so kind, we'll have her over next week." So really supporting through praise every time your child sticks to a guideline. Any questions on this?
I do have one just seeing that you're talking about, best practices. As we know, a lot of diseases are hereditary. And so, I'm sure that's in the books that you recommended. That's part of it is like how to like you let them know that. I'm sure that's a hard conversation. Hey, I have this thing. It runs in our family because, of course, the child's going to be scared. And so, just curious to know, because I imagine you would also want in that scenario to talk about best practices of like how to be very healthy to, maybe that if you do have it, then it minimizes the impact or something. But any thoughts to share around hereditary conversations?
It's such a good question, and I'm glad. I like that you're really hitting on like all the different chapters that I have in the book. So that's great because I have a whole chapter just devoted to talking about heritable conditions
Yeah.
because it is such an important conversation, and there are different types, right? Because even genetic diseases, they might not inherit because your partner's a carrier and
Sure.
you're not. I This is such a complex topic that I have a hard time getting into it too much because there are so many it really depends on the type of condition when you tell your child
Yeah.
and how. So
Yeah.
for example, if there is 0% chance that it's going to affect their childhood, it's safer to wait to test them until later. You can
Mm,
talk them anytime. I'm talking about genetic diseases.
sure.
If it's a condition where it might require testing if they have it,
Mm,
you're going to want to testing to make sure they're fine. You're going to want them to have the genetic test to see whether or not they have it at a younger age, which requires different kinds of more intensive conversations, maybe best done with a genetic counselor. Then there are autoimmune conditions that they may or may not inherit that they probably won't really find out about until adulthood.
Sure.
So you can tell them that it's a runs in the family, asthma, lupus, those things do have a genetic component, but often they're primarily environmental and there's not necessarily a test for them.
Sure.
So it's a great question. One of the best tools that I found that I have a template for is to make a family health tree and to just put the grandparents in, aunts and uncles, everybody's different health conditions. It's a very clear way to explain, first of all, that everybody has health stuff going on.
Yeah.
It's very normal, very natural, but also here are some things that run in our family that might crop up in your own history far in the future.
Yeah. Okay, wonderful. I love that idea.
It's a really good question because I can keep going. I think a final thing I will say is to your point, there is also this this is why genetic conditions are so complicated, but there are some that there's no chance a child will inherit it unless both parents are carriers.
Hmm.
So that becomes something that they have to think about as they start dating and as
Hmm.
they start to get into
Sure.
relationships.
Sure.
When do they have that conversation with their partner? So that's sort of a whole other kind of conversation you're having with teenage and adult children.
Yeah,
So
interesting.
you can see why I said it's like it's a
It deserves a chapter. I agree.
yeah, yeah.
Yeah.
But it's a great question. So that's it. Those are really the big topics that I wanted to hit on, and some of the most important that any parent with a chronic condition is going to face. Any other questions or comments?
I was gonna say, I had a question because I found out my parents had like diabetes when my brother told me. He just blurted it out. Uh, I think I was like 16 or something like that. But then I've seen some of my family members go through like health conditions and then they'll get well, except for like two uncles that just never got better. So at the time, I just didn't know what to do with that information. Also, I was a bit scared, but then I was like, well, I've seen like my grandma felt really sick, but then she got better. So maybe my parents are gonna be good. So until up till now, I'm not sure if my dad, because my dad had diabetes, my mom did too. My mom is a lot better because like she's very good with like she's very determined when she wants to do something. So she just like reduced eating sugar, carbs, um, like she works out a lot, and so she doesn't really like deal with any of that. But my dad, sometimes it would be like he'll get really he'll be at work and he feels like passing out, so he'll
Mm,
tell me to come pick him up. But then a few days later, they would just be fine. So, in as much as like I will be anxious, no one knows how to explain anything to me. So I'm like, did it affect me? As to like how I deal with sickness now? Because when I get sick, I'm like rushing. I have to go work out. I have to get my body like flowing with blood flowing, like fight it before I actually fall sick. So I'm not sure if like there are any like symptoms within like how I deal with sickness.
hmm Is
Yeah.
it type 2 diabetes for your parents? Do you know?
Um, I believe it's not like a really terrible one. It could be like type 2. I did hear them mention it sometimes. They say it sometimes. My dad really just hides his medical records if it's that, I mean, intense. Also, he doesn't like stressing us, but sometimes you want to know. I think it's type 2. My mom just randomly told me that, hey, so I'm not like, I don't have diabetes anymore. Like, don't worry about your brother. Like, he was just, yeah.
And but I think your parents are such a classic example of most, I mean, most of the people I talked to so many people that say, my mom had Parkinson's and didn't tell me for 10 years. I mean, just I hear things that astonish me, but I do think parents have this deep-seated instinct to protect their children, but I don't know that children always benefit. I think it just really depends, but I
Yeah.
think, research shows and from the parents I talked to whose kids really adapted and internalized it well, it just became part of the family fabric to talk about it all the time. to tell the kids when the appointments are and to give them all kinds of, good updates. Again, always blending information with reassurance. So if your child knows you're going to the doctor or your parent, your parents maybe, I don't know if they see endocrinologists because I don't know what type of diabetes it is, but if they're just checking in with you and saying, "Hey, I have an appointment on Thursday," and afterward, "Yeah, it went well, no real changes. I probably need to be exercising more or whatever." But that's so important for adult children too, to keep a pulse on their parents and not worry too much. The fact that you're not even sure what kind of diabetes it is tells me that they're afraid to talk about it. They don't want to worry you probably, but then you
Yeah.
don't know, and you don't know how to support them if anything happens that's related to that, because diabetes can cause all kinds of sort of domino effect type things, a lot of which are manageable, but as their child, you probably want to know about that. So
Yeah, I think it
good
also
energy.
just it made me take in the fact that like when you're sick or something is wrong with you, just don't share it. Uh,
Yeah,
I
yeah.
think that's how I took it. So I don't know.
And it's not anything to be ashamed of. I feel like that's such a great lesson to teach children. You don't have to apologize for this. It's not anything that you did, and you can't, if you're doing everything you can to treat it, it's not something that you need to apologize for. It's
Yeah,
because that's a whole other topic. If you have to miss a birthday party or a soccer game, you can be apologetic that you missed the thing, but not apologetic for having the condition because it's no one's fault. And it's interesting that maybe you internalize this message that we don't talk about health problems. Yeah.
yeah. Because I mean, even if they're sick, my dad, I know for sure, even if he's sick, he's gonna attend that event. Like I don't know how he does it, you know? But sometimes when I'm sick too, I don't think he understands how much like I can't tolerate as much pain as he does. So
Hmm.
he just sees it as, okay, you have a headache, just go like take some rest and go to work. Like, you know? So it's like, I mean, it just makes you just take in like health as in, oh, it's not like that serious. Like, you need your health, but certain conditions should like be easier to deal with. Like if I have a headache, I should still go work and do all of the things that I would do if I was like not having a headache.
Hmm.
Yeah, like he would go to like family events for the sake of not disappointing people, but he's not feeling okay. Yeah.
It's an interesting, I'm writing this down because you raised a really interesting.
Yeah.
Okay, thank you. That was a really interesting point. Um, anyone else? Any other comments or thoughts?
Yeah, I have a few more questions. The let's see, you had said you showed the book and you're like, and this is perhaps if it's more serious conditions or perhaps even terminal. Um, that's the hardest of conversations, I imagine, and just at a high level, if you can convey any information of, best ways that's recommended when someone has terminal disease.
And those are the books that do exist, which is great. And that's what I do in the book is point people to that because
Yeah,
I do really try to keep the focus on it's sort of a narrow subset, but there are still hundreds of millions of people that have the diseases that I'm talking about. But I'm really focusing on
yeah,
physical sick, like being sick, like
yeah,
autoimmune, genetic. I get
okay,
into mental illness a little bit, but really the focus is on physical conditions.
yeah,
I do talk about depression because depression, I think, is physical. It's chemicals. It's a brain illness. But when it comes to terminal conditions, I have resources that I suggest for that
yeah,
because I just didn't even want it anywhere in the book. Because to be honest, the books that do exist, the handful I did find, I got scared picking them up, even though I was reading them as research once I decided to write the book, because I mean, there were chapters called things like planning a funeral is a family process,
yeah,
deciding what to leave your children. And my greatest fear would be that something would happen and I wouldn't be around for my son. That is what every single parent I talk to says, regardless of the condition. It's kind of amazing how much my conversations are verbatim. the same. People just want to make it to their child's high school graduation, their college graduation,
Sure.
right? So I didn't want to have even a little bit of that in the book. Um, what I have found in terms of resources that have been great are to again, follow scripts. I think scripts are very
Sure.
helpful and to take notes like we talked about today. Um, but it is an incredibly difficult and incredibly painful conversation, sometimes done best with a child life specialist or a child psychologist, sometimes done best depending on the family with a religious figure. Maybe that's what they're comfortable with.
Mhm.
There's a lot of really great advice on there about what language not to use so that you
Mhm.
don't confuse your children. Not saying things like losing someone to a small child is very confusing because they might think that they're just lost in the neighborhood or,
Yep.
just being very clear about what's going to happen. Um, and what the next steps are going to be. But that's kind of beyond my realm of expertise because I was really deferring to the books that are great that exist for this. There's books for
Okay.
cancer,
Yeah.
um, it's a
So
really good question. Yeah, but I defer to the experts on that
no,
one.
no problem. And actually, you hit on something that now makes it more highly relevant to not only it sounds like part of what you concentrate on, but also to me, because I entered into this wonderful conversation saying, well, this doesn't apply to me, but be wonderful knowledge to have, and certainly something I can share with the world, but also with friends that may come across us. And then you said, but depression counts, and I deal with depression, and right now I feel fine. You asked me 6 months ago, I was in high anxiety and just like feeling really down. And what I have found, just knowing that my daughters are 8 and 9, that I've been pretty transparent about, hey, sometimes I'm depressed. Um, but at some point, maybe I'll be better at the right ways to communicate with my son as he gains awareness. The thing that I've noticed my eldest daughter doing this month is she'll just like look at me and go, "Are you sad? Are you okay?" Which is very nice, and I'm not sad, so I get to explain, no, everything's wonderful. But um, I'd love just any insights on, best ways to handle those conversations, specific to depression.
I think that it would be very healthy. I'd be curious to know what your experience would be to basically adapt the 5-point script that we did with facts and figures about depression and teaching your
Yeah,
children about it that way.
yeah, no, I'll do that.
This is something that I have. This is when I developed it. Sometimes it gets a little worse. Maybe you take medication for it, maybe you don't, but tell me, this is the medication that I take. This is the
Yep,
medication I might take someday. I work with a therapist. I work with a psychiatrist. I don't know what your situation is, but really following that same script and saying, but pairing it with the reassurance. It's one of the most common conditions in the world. Because the thing is, I say a billion people have chronic conditions. When you factor in depression, back pain, anemia, and hearing loss, and I think one other one, back pain in the sense of back injury from
sure.
manual labor, 96% of people have a chronic condition.
Yeah, yeah,
So when basically almost everybody on the entire planet, right?
right.
And depression is one of those big ones that makes it swing because I think there's about a billion people that have depression. So being able to tell your child that as well, like it's incredibly common. It's nothing we have to hide.
Yeah,
And I mean, you run a mental health nonprofit, so I'm sure you're very good about talking about this with your children, but saying it's something that I work through and that I'm managing. And if they ask if they can inherit it, you can do a little research and find out the heritability. I know depression is something that can run in families, but doesn't always, right? So that's but I think it would be interesting for you to basically adapt the script that we have that we just went through to tell them to practice talking about it with them and to see how that conversation goes. And like you said, you have two kids that are pretty different. So
yeah.
experimenting with thinking about ways that it'll land a little differently with each child.
Yeah, I love that. I'll definitely do that. And f fair point. Just because I told them once doesn't mean it's too late to tell them in a more structured and meaningful way. So I really appreciate your framework and the script. I think that'll go a long way. And I think you'll also explain some things. And so how I deal with it. centers around just being physically active. And that's kind of how I get through things. And they notice me working out all the time to maintain not just my physical, but my mental balance. And so I think it would make a lot of sense. And then that's a healthy habit for them to pick up as well.
And you touched on a really important thing, and thank you, because I should have said that earlier too. The script should be reused over and over and over
Mm,
again. Because thank you for bringing that up, because just because you tell your children something once doesn't mean all those things that are included in the script are going to land. It's just a helpful way for you to frame it, to remember what you want to talk about, and to communicate the most important things, and then you can repeat it pretty frequently and anytime things change. Because you
yeah,
said right now you're doing great. If that changes in the future, you can let them know. Right now I'm having a bit of a flare up of this. Like I'm really
sure.
not doing so great. And we had talked about it last time, and I'll keep you posted, but that's what it is, just so healthy to be very clear with them and straightforward about what's going on.
Yeah, wonderful. I appreciate that.
I'm glad it can help you on a
Yeah,
personal level.
thank
And I
you.
do think a lot of people, it's so interesting to me how I talk to so many parents that are so deferential to other conditions. They hear that I'm talking to all these people that have, cystic fibrosis or ALS, and they say, "Oh, but I just have lupus, or I just have cancer, but it's in remission." Everybody sort of, I just have depression. It's not people. It's like they feel bad because they don't want to compare it to any other condition. But
Mm,
the way
mm,
that I look at it, they are all difficult to manage. They can all be debilitating. They can all be difficult to juggle with parenting. There is no hierarchy.
sure, sure. Yeah.